Let's talk a little bit more about the Johnson & Johnson vaccine and some other COVID topics. Joining me now, the Chief of Infectious Disease at SUNY Upstate Medical. Of course, that's Dr. Stephen Thomas. Good to see you again, sir.
Good to see you, Jeff.
So Johnson & Johnson is on the verge of getting FDA emergency use authorization. How big will it be to have a third vaccine available?
Oh, I think it's going to be huge. Yeah, they will have their meeting with the Vaccine Advisory Board for the FDA on the 26th. But as the FDA has done previously, they've already kind of shown their hand that they believe that the vaccine has demonstrated itself to be safe and effective. So I would be very surprised if the vaccine does not get a thumbs up at that meeting. You know, it's huge. I mean, it's to have another. We've only vaccinated, you know, 13% of the country have gotten their first dose, and so we have a ton more people that need to get vaccinated. And the more vaccines that we have that are under emergency use authorization, the greater the opportunity to get the country vaccinated and get, you know, make it out of this pandemic and get back to some sense of normalcy.
Give us a little better idea of the J&J vaccine. I mean, it is different from Pfizer and Moderna in a couple ways. It's just one shot, doesn't need that same cold storage. Any other differences in how effective is it compared to those first two? Because those first two are very effective. I mean, studies and trials have all proven that.
Yeah, and you know, the initial effectiveness of, you know, more than 90%, which is, you know, I've talked before, those figures were initially developed in the context of a highly regulated clinical trial, but now there's real world data coming out that's showing that the effectiveness is maintaining at above 90%. So that's huge. The J&J vaccine is, the efficacy is a little bit less, but there's so it's in the mid-60s, about 66% overall. You can look at, you know, some different additional data about, you know, how good is it at protecting people from severe disease or death or hospitalization, and the numbers are even better. But what you have to be a little bit careful is the trials, the Moderna trial and the Pfizer trial were very, very similar, but they're different than how the J&J trial was designed. And so J&J looked specifically at moderate to severe disease, and that's the 66% number. But the bottom line is it's safe, it is highly effective, and people, regardless of which of the three vaccines are made available, people should take whichever one is offered to them.
Okay, so not exactly an apples to apples comparison there. So don't worry if the numbers don't look exactly the same. Let's talk about Pfizer. They are starting a trial of a third dose. University of Rochester actually is one of 4 sites in the country that's participating in that. What does that mean? What do we make of that?
Right. So, and it is not unusual that vaccine developers will look at the safety and effectiveness of a booster dose at some point in time. So I think that you know, what it's in response to is these variants, right? And the concern that these new variants, whether it's from the UK or South Africa or Brazil, or I mean, you know, now we're having new variants in New York and California. You know, it's whether or not having a booster dose and trying to bump up that immune response even more, if that will give us a little bit of an edge on these variants. And so I think that that's probably the thinking behind it.
I want to try to get to this one. We're starting to get to that point where we're seeing households with some people, maybe you have one person who falls in an essential worker, they've gotten it, the spouse, the kids don't. How do they go about their daily lives? Can they have a dinner party with friends or family that are also vaccinated or mixed vaccinated? I mean, we're in kind of this weird position now. How should people proceed with this mix of vaccination, not vaccinated?
Right. So the only thing that we know right now is that these vaccines will reduce someone's risk of getting ill, of getting disease, even if they are infected. What we don't know is whether or not the vaccines will actually reduce somebody's ability to transmit to another person. They are collecting that information. There's some preliminary information that is out there that seems to indicate that, in fact, yes, these vaccines are reducing a person's risk of being infectious to somebody else, but it is far from a done deal. So until further notice, people need to continue with the same kind of public health intervention posture that we've had the whole time. So again, wearing a mask when you can't physically distance or socially distance, and then when you're with people outside of your pod or outside of the people that you live with, then yeah, you again should wear a mask and try to physically distance, when you can.
We're making progress. We go stay the course for now, right?
Yeah, and we are making progress.
Dr. Thomas, thanks so much. Of course, we're out of time, and I had like 3 or 4 or 5 or 10 more questions to ask you, so we'll have you back again soon. But thanks for joining us tonight. Appreciate it.
Yeah, thanks, Jeff.